how are you guys? My name is Charlene Cifuentes. I'm a Salisbury University student.
And I'm Kelly Gorman.
I'm Justine. I'm also a Salisbury University nursing student.
Okay, so we're here to present you guys with the product that we have created as a team. It's called Discharge Plus. So the aim of our product is to tackle the widespread problem of readmission in the hospitals that are resulting due to poor discharge care. So let's just paint the picture for you guys. So you just got in a very bad car accident, and due to this, you are going to be very overwhelmed as it is. So during discharge, you have to be given education and instructions on how to properly care for yourself. And during this time, you are going to be given instructions with medical terminology that you might not be very familiar with, that can result to you hearing everything as gibberish. You're not fully understanding everything. So in result, you're not getting the adequate education that you require. So with our product, it's designed to ensure that patients understand all the education that they require. And this is done by assessing their knowledge deficits based on the quiz.
The video might have thrown that off. Hit the space bar. There you go.
So overall, hospital readmission rates from the first 30 days of discharge decreased by 40% with adequate education. However, we do not have a currently quantifiable standard to determine whether or not patients are fully understanding the discharge teaching you're providing. So the problem with this is that it leaves evaluation of the efficacy of education to the provider or the nurse, whose attention to detail can be affected by their own level of burnout, their own level of stress, and also varying opinions on what points can, for each condition or surgical procedure, discharge education might be most important. So with an added issue with this is liability. So if your patient is not fully understanding all the points that they're giving because there's not a consistent level or a consistent protocol to implement for their education, they might be able to return due to a misunderstanding on what medications to take, what activities they're really able to do and handle. We all talk about being able to lift certain weights after certain surgeries, whether that be GI surgeries or cardiac surgeries. And this does open the hospital to something called negligent discharge, which is something you can absolutely get sued for. So on top of preventing unsafe discharge, for patients, we're also adding an extra layer of protection to hospitals that might be open to liability.
So to solve unsafe discharges, we've created Discharge Plus, which is a discharge quiz, which will be comprised of 5 to 7 of the most important educational topics related to a certain unit, to identify the areas of deficits where patients might be lacking in their education. So we're going to use an interdisciplinary team to create education protocols. So that team will be comprised of a physician, a pre-existing nurse educator, and anyone else on the interdisciplinary team that would be of benefit. So they'll work together, they'll look at conditions they see on the unit a lot, education that is lacking but it's really important, and they will create the 5 to 7 ideas. So after that's made, it will be uploaded to the employee portal, and nurses can just print out that sheet so the patients can take the quiz. If the patient can't read or write, they can also give the quiz verbally. So once the quiz is taken, we want to assess how they did. So the nurse will go, she'll check off what they got right, what they got wrong, and based on the hospital's policy on where they need to be at with their education to leave, they'll determine if they passed or failed. If they passed, you're just going to want to reinforce the educational areas just so you know that they are crystal clear on all of the details of their discharge education. And if they failed, you're going to look at the areas where there was a deficit, and you're going to provide further education, further materials that they can take home with them. And then they're going to retake the quiz, and it'll be a cycle of pass, fail, until they pass and they can go home.
So our primary targets are hospitals, urgent care centers, rehabilitation facilities, mental health facilities, in surgery centers like same day outpatient surgery centers. So overall, there's 6,120 hospitals and 10,720 urgent cares in the U.S. So this opportunity market for this product and where we can implement this is vast. And the nice part is that these consumers can make it specific to their regional area, especially when we're talking about urgent cares. An urgent care in the middle of the city versus urgent care in the middle of nowhere, they're going to deal with different conditions. So they're able to personalize it to what their patient population is.
So when we were looking for products that are like Discharge Plus, we didn't really see anything out there that was similar. And when we were asking our expert if she sees anything in practice kind of like Discharge Plus, she said that no nurses in the past 15 years that she's been working, she's seen this implemented. So I found something called the Readiness for Hospital Discharge Survey. And that's a survey that looks at how the patient feels in relation to getting discharged. Like if they feel ready emotionally, physically, and it looks at those standpoints. So we want to also look at that in Discharge Plus, but additionally, we are going to be looking at the patient's understanding of their discharge instructions, how much they know about the medications they're going to have to take, and their knowledge of further up treatments. So RDHS does not look at that at all. It only looks at the feelings of it. So our value proposition was for hospitals who need to lower hospital readmission rates and reduce unsafe discharges, Discharge Plus creates a quiz for patients to ensure that the healthcare team, that they are competent in their discharge instructions and further needed care. Unlike the Readiness for Hospital Discharge scale, our product will assess the patient's knowledge of education given at discharge, medication knowledge, and knowledge of further treatments and follow-up care. The Readiness for Hospital Discharge scale is about the consumer's experience and not about their understanding of discharge education, as Discharge Plus is.
And overall, to wrap up everything that we spoke about, overall, the product that we have talked about is going to decrease admission rates in the hospitals, and this stands out as it is the only discharge quiz available on the market, and it offers a standardized approach to patient discharge education. It also improves patient comprehension of their education, so in return, this is going to increase their patient safety and outcomes. This is overall a very smarter and more effective discharge process for not only the patients but the healthcare providers as well. Thank you.